today. This stadium is a model for other communities across the country and how they can operate in partnership with the federal government to vaccinate more people. Our support to the state goes beyond State Farm Stadium. We've deployed almost 300 federal personnel from FEMA and 3 other federal partners to support vaccination operations across the state. That includes over 100 vaccinators from HHS that we sent just this weekend. At the request of state and local leaders across the country, we've made the cost to build these sites fully reimbursable through FEMA. Just yesterday, FEMA awarded $20 million to the state of Arizona to support the COVID-19 response, including vaccination operations. These funds can help support building new community vaccination centers, just like this one. Here's a look at the site you're going to see today. There's a great team on the ground who's going to walk you through it. So now let me introduce you to Dr. Kyrsten, the director of the Arizona Department of Health Services. Dr. Kyrsten, over to you.
Good afternoon, and we are so honored to have you here at State Farm Stadium in Glendale, Arizona. I want to take you into the command tent where we manage the day-to-day operations of the state's only and 24/7 state-operated vaccination site. So come on in. So State Farm Stadium is the first 24/7 vaccination site in Arizona. We have a dashboard that we monitor all of our data that we look at. And so we are averaging between 8,000 and 9,000 vaccines per day. That currently is both first and second doses. It's about 350 to 400 vaccines per hour. And like was said, we've vaccinated almost 170,000 times out here at State Farm Stadium. This one site is responsible for over 18% of all of the vaccines delivered in Arizona since we started. Our full capacity though here is 12,000 vaccines per day. Let me take you over to the site map. So we have an electronic registration system that people can either log in online and sign up, or they can call a call center if they're not comfortable working on the web. But they will come in, they will have an appointment, they will get checked in, and we will make sure that they are registered at the data verification. It's all done electronically. They will come around to our vaccination tents where they receive their vaccine and then are asked to stand for about 15 to 30 minutes. This is all done in the comfort of their own car, which is really important potentially as we head into the warmer months here in Arizona, and it allows for our vulnerable residents to stay socially distanced. During their 15 to 30 minutes that they are spending with us to make sure that they're safe, we are registering them for their second dose appointment, as well as getting them their vaccine card. We also have a really strong partner in Walgreens. They are set up and they manage a 24/7 pharmacy on site in State Farm Stadium. And the main goal of this site was to really accelerate getting vaccine into the arms of Arizonans. This has accelerated our efforts here in Arizona. And we weren't sure what a 24/7 site would look like. We weren't sure that we would have the demand that we needed. However, our sites and appointments book up very quickly, and our flow through the night is just the same as it is during the day. So we're running about 350 to 400 people through per hour. What that has helped with is the 24/7 nature of this operation allows us to ensure that no dose expires or goes unused. So we've also got plans with our other pods in the valley that they can transfer vaccine to us to make sure that they're not going to expire doses as well. We are still in our phase 1A and prioritized 1B populations here in Arizona. And there's an eligibility whether you call in or you sign up here. But we're still doing healthcare workers, long-term care residents, protective services, our educators and childcare, as well as adults over the age of 65. One of the other things that we've found really helps us keep up with our vaccine supply is to offer +1s. So that is a clinical decision that is offered to somebody else who may have accompanied that individual in the car, whether it's a caretaker, a family member. We're trying to get as many vaccines into the arms of Arizonans. So we want to make sure that all of those around some of our vulnerable residents are protected. The other thing, we have a very large influx of winter visitors and migrant agricultural workers to Arizona this time of year. So Arizona has made the decision not to restrict vaccination to residents. You can be from anywhere in the United States and we will still vaccinate you if you are able to get a partnership. And the final thing I want to touch on is this could not have been possible without the partnerships from FEMA, from our state emergency management, but also the private-public partnerships that we've established. Without the Arizona Cardinals, Walgreens, Arizona State University, and Blue Cross Blue Shield of Arizona, we wouldn't be able to function as effectively as we have. And this site was developed to be replicable, so we can scale it up and we can send it to other sites. In fact, last week, we just opened our second state-operated site at Phoenix Municipal Stadium. We're running about 2,000 to 3,000, but it has the same capacity as State Farm Stadium does at 12,000. And in the next couple of weeks, we will be opening up our third pod down in Pima County, which is Tucson, our second most populous county here in Arizona. I'm happy to take any questions that you may have.
Doctor, let me ask you, Joe Biden, let me ask you a question. Were you able to do this, would you be able to do this without federal help? The reason I ask it is a lot of states originally said, we're fine, we don't need any help, we'll just get us the vaccine and we'll be fine. Talk to me practically about what it took to get it to this stage.
So without the federal funding and without the federal partnership, this would be a huge logistical lift. And so the fact that we've got such great partnership with our federal partners, whether it's FEMA, whether it's HHS, that's been the crux. And so without that funding and the vaccine and the vaccinators that have come out here, along with all of the logistical support that we've gotten, it's a huge lift to put something like this together.
Why did you decide on this site for the drive-through?
So that is a great question, Mr. President. One of the things is our partnership with the Arizona Cardinals. So Michael Bidwell and the Cardinals have been strong partners throughout the COVID response. We actually had a testing site in partnership here with ASU, Arizona State University, as well as the Arizona Cardinals. So we had some of the infrastructure and the plans in place to then build into a vaccination site. But it's also got great freeway access. Everybody knows where it is. We can do freeway signs so that people can easily navigate into the parking lot. And with the NFL season in Arizona being over, it was the perfect partnership.
I got a call during the Super Bowl from the commissioner of football and offering us, the federal government, the 30 major stadiums. So I think they're going to be coming to you to look at how you did it because you're doing such a great job. One last question. I was pleased and a little surprised to hear that if a caretaker drove somebody, or if I assume a family member drove someone who qualifies to get the shot, they would also qualify as well. Is that correct?
Yes, it's a clinical decision made on site at the time. It depends on our vaccine supply and the capacity that we have at the site to be able to register that additional person. But we really try. We know that people are in constant contact with family members and loved ones. And the more we can do to surround them with vaccinated people, like their caretaker, it just keeps people safer.
Well, one of the things you may recall, the Vice President and I announced about 15 days ago that we're going to try to get 100 million shots in 100 days into people's arms. We found out we didn't quite have the supply of vaccine we thought initially. We're all set now, but we're exceeding that number. And so because of folks like you who are dedicated, and I just want to, before I turn it over to the Vice President, she may have some questions, I just want to thank you for your dedication. You're saving people's lives, short-term and long-term. So thank you, thank you, thank you. I'm looking forward to meeting you one day.
Hi, Doctor. I joined the President. Thank you, thank you. This is an incredible model. How are you reaching out to your hardest hit communities and those who may have a difficult time with transportation or just proportionally are some of the hardest hit, but maybe not receiving the vaccine at the greatest numbers? What kind of outreach are you doing?
We lost you, Doc.
Uh-oh, you're muted.
Am I good
Yep.
right now?
You're good.
Yep.
Does that work? Okay, perfect. Okay, sorry, the technical. So that is a really great question, Madam Vice President, and something that here in Arizona we feel strongly about. So this is just one portion of our state vaccination plan. So we are looking to partner with community leaders to put community-based pods in some of those hard to reach and targeted zip codes. We have contracted with communications groups that specialize in reaching our Hispanic, Latino, or our hard to reach populations to do intense communication about the importance of vaccine. We're also working with our state's Medicaid program to ensure that we've got non-medical transport available that they can use if they want to come out here to one of these sites or any other sites. And we're also taking advantage of the CDC's retail pharmacy partnership to make sure that we're getting those vaccines into pharmacies in hard to hit areas, as well as our community health centers. And so that's just a little bit about the plan, but we definitely are trying to target those populations because we know how at risk they are.
And my other question is, what's the proportion, do you have a sense of the folks that are getting the first vaccine versus the second vaccine?
So we here are very surprised at how willing people are to get that second dose vaccine. So we've been, that was one of our lessons learned here at State Farm Stadium. We register people for their second dose before they actually leave the site. And prior, we had been just telling them we would email them. That has been great. We have high demand for second dose, and we actually take people who are looking to get their second dose, but can't find it somewhere else here at State Farm as walk-ins.
That's great. Thank you for your work. And to your whole team, thank them.
Doing a great job, Doc.
Thank you.
All right, well now I am going to hand it over to Brittany, who is our lead clinical supervisor. She is out at the vaccination tents, and I know she's looking forward to talking with you.
Thank you.
Hi, I'm Brittany Hayes. I'm with Arizona State University. I'm the head charge nurse here at the vaccination pod at State Farm Stadium. So I was just going to walk you guys through the process. Let's see, I have 10 lanes here at the vaccination pod. I have 3 people in charge of each lane. I have a data verification person. They are in charge of entering and charting in the vaccine management system. Once the cars are all checked in, then they come through to the tents where I have a vaccinator and I have a clinical assist. My clinical assist is in charge of safety. They'll ensure that the car comes in, puts the car in park, all the windows are down, my car is turned off, and then they'll write the time on the windshield of when they've entered that pod. And then my vaccinator. My vaccinator is the first clinical person that a patron sees as they come through. And they are in charge of an assessment, pretty much looking for if they're acutely ill, if they have allergies, anything that we need to know so we can know if they need to stay for 15 to 30 minutes, if they're eligible for the vaccine. And then they are to give the vaccine using the proper technique and safety. So safety is a big part of what I'm in charge of here, ensuring that sharps containers are used properly, PPE equipment is used properly as well, infection control risks, ensuring that we are giving the vaccines through the car door windows if we can, and then in charge of contraindications to the vaccine. So some of the challenges that I have endured here, as you know, this is a big operation. We have a mix of volunteers and staff. So just making the process as simple as possible so somebody can come in not knowing anything about what we're doing, and then training them as easily as possible and getting them to work an 8-hour shift safely and effectively. And I think we have really narrowed it down here at my vaccination station to where we do a huddle, they are given their pertinent information, and then they are trained by the previous staff. And then as far as other challenges, we are 24/7 site, so the no production has been a challenge for me, so we have to implement things on the fly. And how do you communicate that with 50 people that are working your site? So I have dedicated leadership staff that are here and help me with anything I need, and they are wonderful, and their dedication is greatly appreciated. And then as far as some of the successes, I mean, we were vaccinating one vaccine per 10 seconds. So I feel like that is very impressive. And we are giving people hope, giving volunteers and staff purpose. And then feeling united. This has been a long year, and I'm just thrilled that we can give that unity back.
We're really proud of you.
Thank you.
No, I really mean it. Tell me about the number of volunteers. Are these pure volunteers? They get per diem, or are they pure volunteers?
Partners with Blue Cross Blue Shield for our volunteers. I'm not exactly sure everything that goes into that process, but over 50% of probably what is on my vaccination pods here are volunteers. All of our datafication people are volunteers.
And when someone comes through in a vehicle, do they have to demonstrate proof of eligibility, or have they also been cleared before they get to that tent?
That's what I'm for. The charge nurse, I have dedicated that to them to make that decision. If they have allergies or something along those lines, immunocompromised, if they had COVID and had the convalescent plasma, that's my job to dig a little deeper than what the assessment of the vaccinator is, and to really see that they are eligible, because I want to give the vaccine to everybody comfortable.
Now, in Arizona, what is the age eligibility for coming through that tent?
So since we are doing the Pfizer vaccine, it is 16 and over, but the 16 and over has to be, the appointment needs to be made online. If they are walk-in, it does have to be 18 or older due to them just being minors.
Gotcha. And what do you hear from the folks coming through that get the vaccine, that actually you get the shot in their arm? What are the kind of things you most often hear from them or your volunteers?
They're amazed. Yeah, no, I'm sorry. They're amazed by the process, the smoothness. I hear that a lot. I hear a lot of other touching stories, that people have gone through due to COVID, and they're here, and really we're instilling hope. A dose of hope is what I've been calling it. I've heard, but the smoothness of the process is what I hear most.
Last question I have: how can we best support you and other frontline workers?
That's a great question. So the collaboration that I have with FEMA, all the other state, everybody that I've partnered with here, I get nothing but the utmost support. And it's been amazing to collaborate with everybody. They check in. If I need something, it's done. They know that I'm trying to do everything to make this safe and efficient. So, support. Yeah.
Are you a freshman at the university?
No.
I'm kidding. You look like a freshman.
Well, thank you.
Well, no, thank you for what you're doing. It really matters. As I said to the doc a few moments ago, Dr. Kyrsten, we committed when we got in. We were short on vaccines and short on organization, and when we got sworn in, and we committed to do 100 million vaccinations in the first 100 days, and we're exceeding that. With the grace of God, the goodwill of neighbors, and help of people like you, we're going to end up doing more than that. So thank you for what you're doing. You're saving people's lives.
Absolutely, and I'm more than happy to be here.
I'm going to turn it over to the vice president. She's got the tough questions.
Hi, Brittany.
Oh, okay. Hi.
Hi, thank you for everything you're doing. You are a role model of how this kind of approach can work. And thank you for that, because it's not easy being a role model and being one of the first. But that being said, you're a leader really in the country around what you're experiencing right now and how that can help others that start to pop up. And we intend on doing this around in many places around the country. So what would your advice be to others who are setting up an operation like yours? What did you learn worked and what didn't work, so we can learn from whatever you have experienced?
I think, like I said, one of my biggest challenges was staffing and just how to incorporate. I feel like I had incorporated things that I had worked, as a bedside nurse, getting a huddle together, getting a process together. I have made a actual charge binder, is what I've been calling it, that has everything